The 89th Texas Legislature is over, and now that the dust has settled, it's time to take a look at some of the laws that will be coming into effect over the next year. Today, I'm sitting down with Caroline Welton from the Texas Public Policy Foundation's Center for Health and Families, which, to no one's surprise, deals with healthcare and families. Caroline is our go-to person for everything healthcare. Caroline, thanks for joining me.
Thanks for having me, Austin.
Awesome. So one of the bills that we're really excited about is HB 2038 by Representative Tom Oliverson. It's also called the Doctor Act. So in the context of this bill, what does doctor stand for?
It stands for Decreasing Occupational Certification Timelines, Obstacles, and Regulations. So say that 5 times fast.
I'm not even going to try to. So the Doctor Act is supposed to help create alternative licensing pathways for physicians to help address a physician shortage in Texas. So first off, is there a physician shortage in Texas?
There unfortunately is. Just to give you a few numbers on this, Texas, by official numbers, is projected to be short over 10,000 doctors by 2032. This means that over 6 million Texans currently live in official health provider shortage areas, and 37 counties in Texas lack one single primary care provider. So this really is one of the big healthcare issues that we're seeing in this time.
Wow, that is really concerning. And I would hate to imagine not being able to find a doctor when I need one.
For sure.
So how does the Doctor Act fix this? Like, what does it do to help?
Yeah, no, thank you. So this act expedites licensing pathways for 2 classes of already practicing physicians who would otherwise have to repeat licensing and residency requirements to be licensed in Texas. Those 2 classes are doctors who were licensed internationally and military veterans. And then it creates a third standard under which medical graduates who didn't match into their first choice of residency can practice under supervision while they wait to try and match into another residency.
Okay, awesome. So that helps get more doctors into Texas fast. The next bill I wanted to look at was Senate Bill 1318 by Senator Charles Schwertner. It restricts non-compete agreements for licensed physicians. I think we all know how non-competes work in something like sales or other kind of client-driven businesses, but how do they work in healthcare?
Yeah, so in healthcare, non-compete agreements provide physical limitations usually to where a physician can choose to work after leaving his place of employment, which in practice often means needing to relocate cities, which impairs a patient's ability to follow their doctor, which about 85% of patients prefer to do, many of them not finding another primary care provider after theirs leaves.
Okay, so I could see how that'd be a big issue. How does Senate Bill 1318 address this? What does it do about the non-competes?
Right. So this bill expands restrictions on non-competes to all healthcare professionals, actually, including dentists and nurses. And it also limits that geographical distance that I mentioned to within 5 miles, hopefully meaning that less care will be lost.
Right. So I could follow a doctor maybe 10 minutes further away instead of having to switch cities for him.
Exactly.
Right?
Yeah.
Awesome. The last bill I wanted to talk about was Senate Bill 2312 by Senator Brian Hughes. This is called the Pacific Stress Test, and it's actually a study bill, which means it doesn't necessarily change the laws. It just does a state-sponsored research on certain subjects. One of the things it's doing is studying the pharmaceutical drug supply chain. And I know I've heard a lot in the news about pharmaceutical drugs coming from China. Why would this be an issue?
Well, not only our political independence, but also the quality of care, that standard that we hold ourselves to in Texas of being the best, is impacted by a lack of assurance about where our pharmaceuticals are coming from. Are they top quality? And we just don't know that.
Okay, so this specific stress test, which is studying a whole bunch to do with China, is studying the drug supply chain. What are we hoping to see come out of that study?
I think we would want to see clarity come out of it, identify any of those weaknesses in our drug supply chain, which will then give us opportunities for strengthening that in future sessions.
Awesome. That makes perfect sense. Well, thank you, Caroline, for coming in today, and I'm already looking forward to next session.
Thanks so much for having me.